Thanks to you at home for joining us this hour. Really happy to have you with us. This is one of those A blocks where you're not going to know why I'm starting with what I'm starting with. But if you stick with me till the end, it has a really big payoff. So let's break the wall a little bit to tell you how this is going to go, but that's how it's going to go. I want to start in 2018, which feels like roughly 35 years ago now, but 2 years ago, 2018, the country had a big problem with lettuce. There was an E. coli outbreak affecting romaine lettuce in the United States in 2018. Do you remember that? It was a big deal. Illnesses reported in 36 states, 96 people hospitalized, more than 24 people got a really serious complication that basically resulted in kidney failure. 5 Americans ultimately died. When that happened in 2018, the FDA and the CDC and investigators in several states they got together and did the public health detective work that needed to be done to figure out what had gone wrong in that outbreak. And those investigators ultimately pinpointed the source of the problem with romaine lettuce. And that was both a hard thing for them to do. It was very impressive. But it was also something that had really practical consequences for us, the lettuce-eating public, and for the produce industry that sells the stuff.
At the Pasadena Farmers Market this morning, lettuce lovers can shop easy, knowing this locally grown romaine is safe.
I had a couple customers ask about the romaine lettuce, whether or not ours was California grown, if it was safe to eat, and yes.
The concern? Romaine grown in Yuma, Arizona, and shipped across the country. The CDC is warning about an E. coli outbreak from lettuce grown there, telling grocery stores, restaurants, and consumers to toss it all out if they can't be sure where it came from.
We're really looking at lettuce in the grocery stores that's coming from California, not from Yuma, Arizona, and is not affected by this outbreak.
A distinction that puts local shoppers at ease.
We know which farmers are here. I feel confident that we're not going to have any issues.
Matt Bradley, NBC News, Pasadena, California.
California lettuce shoppers at ease once the disease detectives found that the contamination in romaine lettuce in 2018 was not coming from California farms, so it was safe by California romaine. It was an interesting public health case study. The team that did that investigation produced this report that not only outlined the problems that they detected at these farms in Arizona, they also produced really blunt findings about what growers and processors needed to do to fix this problem and to avoid something similar happening in the future. It's really, blunt, specific advice. Assess and mitigate risks related to land uses near or adjacent to growing fields that may contaminate agricultural water or leafy green crops. For example, nearby cattle operations or dairy farms, manure or composting facility. Also, assure that all agricultural water that directly contacts the harvestable portion of the crop, is safe and adequate for its intended use, including agricultural water used for the application of crop protection chemicals. Really specific stuff, and it goes on like that for pages. And documents like this are common in the food industry and in public health at large. The CDC specifically has a whole team that works on things like this for public health, the Epidemic Intelligence Service. And it's as cool as it sounds. I mean, they really are more like detectives than anything else. And there's public evidence of their work everywhere. We get the reports on what they do. There was, for example, a deadly food poisoning outbreak associated with the Jack in the Box fast food chain back in the early 1990s. I remember how freaked out everybody was about that. It was a big concern. The CDC investigated that to figure out what was going wrong. That was how America figured out what happened there and how Jack in the Box got back on its feet. Here's the report from the CDC report after they investigated an outbreak on South Bass Island in Ohio in 2004. It was an outbreak of gastroenteritis. They didn't know where it was coming from. The CDC came in. They traced it to contaminated groundwater on the island, and they made a bunch of really specific recommendations. Quote, the septage disposal site should be closed and septage must be disposed of at the sewage treatment facility or off the island. Quote, residents should not consume groundwater unless the source has a demonstrated history of negative bacteriological results. All island groundwater should be treated before consumption. A moratorium on the construction of new on-site wastewater treatment and disposal systems should be imposed. when you have a bad public health situation of some kind, people are getting sick, and it all seems to be from some sort of source, but nobody can exactly figure out what happens is the CDC comes in, their disease detectives investigated it, they investigate it, and they tell you what you need to do. And then you do it. I mean, this is the system that we have in this country. And it's for, big famous outbreaks like the Jack in the Box thing. It's like that island outbreak in Ohio that you'd never heard about. Duval County, Florida in 2012, they had a TB outbreak at an assisted living facility. It's one of the biggest tuberculosis outbreaks in the United States in more than a decade. The recommendations there, again, were blunt and, straight up CDC style. Screen all staff and clients with one of these 4 forms of testing. Replace ventilation filters monthly. Keep records. Require proof of TB screening for all staff and clients. And this is how things have looked at the CDC, going back to the 80s and 90s and the early 2000s. This is also what they look like during the Trump administration. For example, when they found Legionnaire's disease at a veterans home in Quincy, Illinois 2 years ago. The CDC came in and did one of these investigations. They call it an epi-aid. And they told them what they needed to do at this veterans home. Quote, residents who develop pneumonia should be tested for Legionnaire's disease with one of these 2 types of assays. With both of these 2 types of assays. The CDC told them who exactly should supervise patient transfers from the veterans home to the local hospital. CDC picked who should be in charge of those transfers to make sure that the Legionnaire's testing didn't fall through the cracks for any veterans who were transferred from one place to the other. The CDC went so far as to tell them how to re-rig their plumbing, their thermostatic valves, to ensure that the water temperature was right inside the veterans home to kill off the bacteria. Quote, the veterans home should establish control limits for the hot water temperature ranges at fixtures prior to mixing. I mean, this is how it works. It's really good that we have them and that they're a top shelf organization. CDC gets called in because there's a public health disaster somewhere. They investigate what happened. They tell you what to do to fix it and to stop it from happening again, and you do it. That is how it works. That is how it's supposed to work. That is not how it is working now. Let me explain. But let me also back up for a second first. As of today, the U.S. has now over 1 million cases of coronavirus, absolutely dwarfing any other epidemic anywhere else in the world. We are up over 58,000 Americans dead from coronavirus over the course of not much longer than 1 month. Remember when the University of Washington model that the White House was relying on said that we would likely hit 61,000 dead Americans by August 4th? That was the projection the White House was relying on. Well, we're likely to hit 61,000 dead Americans by the end of this week. Easy. And it's still April. So the rosy estimates about how we were going to get out of this with just 50 or 60,000 people dead. No, today that University of Washington model that the White House has been relying on, they revised upward their estimate of how many Americans this thing is going to kill. They now say they think it'll be more than 74,000 of us dead by the first week of August. We'll see. Americans, by large majorities, support the policies that have been put in place to slow the spread of the virus, the stay-at-home orders, the limits on the size of gatherings. The Washington Post has a new national poll that shows that really big majorities of Americans, nearly 2/3 of Americans, support those policies, plus another 16% of Americans who say the restrictions actually aren't tight enough, that we should be doing more. Nevertheless, there are governors around the country who are starting to tell businesses and different entities in their states to open up. And the White House is letting them all do it, encouraging them to do it themselves, make up their own models for disease control in a global pandemic. And governors often go out of their way to say that they're very data-driven in these decisions, but it's clear that most of them are making that up. Just from the data that we have about what's happening in the epidemic right now, it's at least clear where it's the worst idea to open things up. The New York Times put on its front page today the aggregated local information about where the American epidemic is worst right now. And I find it very helpful, actually, that they stacked the data into metro areas rather than just looking at it by county, because we're not always familiar with what county names mean. But if you talk about metro areas, it's usually something that you recognize. But look at the list. Top 10 places in the country where the outbreak is the worst right now. This is new cases over the past 2 weeks. And you see some expected locations there, right? The tri-state area of New York, New Jersey, Connecticut is obviously the hardest hit area in the country and has been from the beginning. New York City, you see on there in 5th place. Fairfield County, Connecticut is there. Trenton, New Jersey. But look at everything else on that list. I mean, number 1 is Marion, Ohio. Why is that number 1 on the list? Oh, right. They have a state prison in Marion, Ohio, where more than 80% of the prisoners, more than 2,000 men in that facility, have tested positive. So, yeah, they're number 1. Grand Island, Nebraska is ranked 2nd in the nation in terms of where the outbreak is worst right now. The Grand Island, Nebraska outbreak started at a JBS meat processing plant in Grand Island. There's no stay-at-home order either statewide in Nebraska or locally in Grand Island. The governor wouldn't let him do it. So the outbreak there that started at that JBS meat plant has just exploded in Grand Island, Nebraska. Pine Bluff, Arkansas is 3rd. That's another prison outbreak. That's Cummings Prison with over 900 prisoners and staff infected. It's not, you can go by these one by one. It's not rocket science to figure out where and why the raging out of control American coronavirus epidemic is at its worst. I mean, where prisons are testing, those are turning out to be some of the worst and biggest outbreaks in the country. Still don't have a national strategy that we're working on about that, but the more places test, the more you will find that to be true. We're going to have more on that coming up a little later on this hour. So we're seeing it in prisons. We're also seeing it where there are meat plants with thousands of employees. Of the top 10 metro areas where the coronavirus outbreak is the worst in the country right now, 4 of the 10 are places where the local outbreaks appear to have sprung from big meat processing plants with thousands of workers. I mean, why should the Waterloo, Cedar Falls area in Iowa have hundreds of cases and still be growing? One of the worst outbreaks in the country. Well, they'll tell you in Waterloo that it came from the Tyson meat plant there. Why is it one of the worst places in the country right now to be in Grand Island, Nebraska? Because of the JBS meat plant there and the outbreak that started at that plant. The Sioux City, Iowa area, why over 1,000 cases in the Sioux City, Iowa area and still growing? Well, local mayors there would like to know. Quote, the mayors of all 5 cities in Metro Sioux City called yesterday for greater transparency from state and county health officials about places contributing to the recent spike in local COVID-19 cases. In a joint statement, the mayors asked businesses to, quote, take responsibility for any outbreak or spread of the coronavirus in their facilities, publicly disclose any positive cases, and release a detailed plan for reducing the spread of the virus. Employers who fail to comply with these conditions should close until such time a response plan is in place, according to the mayor's statement. The mayors publicly weighed in on the subject as county and state health officials continued to sidestep questions linking the surge in positive cases to Tyson Fresh Meat's Dakota City beef plant, the Sioux City metro area's largest employer with over 4,300 workers. Now, Dakota City beef plant in Dakota County, Nebraska, more than 4,300 workers there. It's in the Sioux City metro area, but the Sioux City metro area encompasses 3 different states. It's Iowa, South Dakota, and Nebraska. In Dakota County, where the plant is specifically, Dakota County, Nebraska, they've already got 600 cases reported in that county. There's no hospital in that county. That's the 2nd highest number of cases in all of Nebraska's counties. The other one is another big meat packing plant. I mean, this Dakota City outbreak, nobody's talking about how many workers are positive there. The mayors, the local mayors there in the Sioux City area, are asking the 3 governors in that tri-state area, the Republican governors in South Dakota, Iowa, and Nebraska, to please provide more comprehensive reporting data to include the specific location of where any outbreak or spread has occurred. They're asking for help. Please tell us where our hundreds and hundreds and hundreds of coronavirus cases are coming from here in the Sioux City area. But, you might be barking up the 3 wrong trees. Because in Iowa, South Dakota, Nebraska, those are 3 Republican governors who never put in place any stay-at-home orders. And who are even today bragging about how much more they're now opening up, even though they didn't actually close anything in the first place. So we'll see how the Iowa, South Dakota, and Nebraska governors feel about the Sioux City area mayors freaking out about their hundreds of coronavirus cases And they're open meat plants with thousands of workers and nobody telling them how many cases there are at those plants. But that's what's happening in that part of the country, which is among the worst hit areas in the country now. I should also tell you that in Iowa today, the lead story in the Des Moines Register is how the Iowa governor, Kim Reynolds, last week received an explicit warning from the University of Iowa about the pace of the epidemic in her state, warning the governor explicitly, quote, prevention measures should remain in place. Without such measures being continued, a second wave of infections is likely. She was advised as such by the University of Iowa last week, but today she moved to loosen everything up anyway. Two of the fastest growing, worst outbreaks in the country are in Iowa, but who cares, right? Open it up. But this meatpacking thing isn't just in South Dakota, Nebraska, and Iowa. It's everywhere there's meatpacking. In Cass County, Indiana, they have no reason to have over 1,000 coronavirus cases in Cass County, Indiana, except for their Tyson meat plant there. In Greeley, Colorado, Weld County, Colorado, where the local hospital is groaning. Local health officials writing to Weld County this week to tell them to please not open anything up. Quote, in our hospitals, we have never before seen numbers of patients relying on ventilators to stay alive. That's local health officials in Weld County. That's because Weld County is groaning under the weight of its coronavirus patients already because of the JBS plant in Greeley, Colorado, with an untold number of workers infected there. Because the JBS plant there decided just not to test them all before opening back up yesterday. They've got 6,000 people in that plant. The plant told NBC News yesterday they are proceeding as if everybody in the plant's infected. They're not testing them. There's no stay-at-home order in Weld County now, effectively no stay-at-home order in Weld County because Weld County decided that they didn't decide to believe that the governor's stay-at-home order was enforceable. And Weld County is telling businesses to do whatever they want. I have to tell you, though, wrap this back around. The CDC did get called in to do one of their famous EpiAid investigations at one of these meat plants, at one of the first worst outbreaks, the Smithfield plant outbreak in Sioux Falls, South Dakota. CDC got called in to investigate what happened here and to tell them what to do. But something hinky appears to have happened there. You remember just a few minutes ago the kind of language I described from the other CDC EpiAid reports on other public health disasters that they've investigated, right? They don't tend to mince their words in terms of what they tell people to do, right? Screen all staff and clients with one of these 4 forms of testing. A moratorium on the construction of new on-site wastewater treatment and disposal systems should be imposed. The veterans' home should establish control limits for the hot water temperature range at fixtures. I mean, that's how CDC EpiAid reports look. That's the language that you find decade after decade, outbreak after outbreak, investigation after investigation from the CDC. Public health disaster in any state of any size, famous or obscure. The CDC comes in, they diagnose it, they figure it out, and they tell you what to do. A moratorium should be imposed. Screen all staff. Establish limits. That's how CDC EpiAid reports are written. Except not anymore. Not in this crisis, apparently. Not in the meatpacking plant in Sioux Falls, South Dakota, that accounts for already more than 1,000 cases in Sioux Falls. CDC went in and did their investigation. Their recommendations in terms of what the plant ought to do, if you look at all the nouns, all the substance of what they say would be a relevant fix, it all seems rational. But for some reason, there's a whole lot of very un-CDC language throughout this report. I mean, it just flat out says, quote, these recommendations are discretionary and are not required or mandated by CDC. What? Look at this. Quote, consider the following actions to physically separate employees. Consider the following actions? Just think about it. Portable hand washing facilities could be utilized. Oh, they could they? Stagger shifts, start times, and break times as much as feasible. Yeah, but Smithfield, don't knock yourself out. If it's not feasible, of course, we understand. Quote, consider moving training online. You should consider that. Quote, make unidirectional paths through the facility where possible. face coverings are generally recommended. Quote, if feasible, all employees should wear face coverings. But if not, no big. Quote, the facial covering should be discarded and replaced when wet or dirty, comma, if possible. What CDC is this? This kind of language is not what the CDC does in these kinds of investigations. Literally, over the course of decades, we've looked at the language in these investigations. This is not the way the CDC tells you what to do after they investigate the public health disaster in your facility or in your town or in your state. All this, if feasible, if possible, consider doing this. This isn't mandatory. You might want to consider. This gives all the meatpacking plants any kind of out to not do any of this stuff. All they have to do is say, oh, that's not feasible. They told us to consider it. We did think about it. We decided not to do it. What is this? If possible, specifically ask employees about recent history of fever. If it's possible, but whatever. The Trump administration, as of tonight, is telling all the meat plants to remain open. There's been dozens of meat plants shut around the country. The president has issued an executive order within the last few minutes that tells all the meat plants to open back up. Why have the meat plants closed? Because they've been infecting their workers with coronavirus by the thousands, and lots of workers have started to die. So when the president is now ordering them all to open back up, what does that mean for all the workers who are working in these environments where in state after state after state, in plant after plant after plant, we are seeing that the working conditions in these facilities expose them to mortal risk? There are thousands of Americans, thousands of people who have been infected at these meat plants already. It's not a coincidence. It's not a one-off. It's happening because of the way these meat plants operate. So should the way the meat plants operate be changed if they're going to be ordered by the president to reopen? The president is telling them to be open, to reopen, to any place that's closed, reopen, right? The Trump administration is also simultaneously, apparently, overseeing a new kind of CDC, where meat plants with gigantic public health disasters unfolding inside them don't actually get told what to do to keep their employees alive anymore. They just get some handy hints that they're free to disregard. And I expect anything from the Trump administration. I do not expect this from the CDC. CDC, are you okay? Would you let us know if you're not? We're going to try to get some answers here next.